also known as vaginal candidiasis. Yeast infection is an inflammatory condition affecting the female reproductive organ. Its most common symptoms include itchiness, vaginal irritation, and discharge. It is a fairly common disease, with 3 out of every 4 women suffering from it at any point in time. However, it is also normal for women to experience this condition more than once. Strictly speaking, yeast infection is not a type of sexually transmitted disease. Although oral to genital contact may cause the infection to spread, there are other ways for this disease to be transmitted. In fact, even women who are not sexually active may still suffer from yeast infection. The main cause of this infection is fungus candida, which is one of the microorganisms and bacteria that naturally exist in the vaginal area of the woman's body. This part of the body is kept healthy because of a balanced mix between bacteria and yeast. Imbalances, such as yeast overgrowth, which is the root cause of yeast infection, will immediately make women to feel various uncomfortable symptoms and other unwanted effects. There are a number of reasons why a woman may suffer from yeast overgrowth, some of which are out of a woman's control. These include, but are not limited to, having an impaired immune system, diabetes, and pregnancy. Sometimes the antibiotics you may be using could affect the pH balance in your vagina, which, in return, leads to yeast overgrowth. There are a few things you can do to lower your risks of suffering from yeast infection. First, you should avoid douching as much as possible, as this is one of those activities which upsets the pH balance in your vagina. Next, be careful when choosing your underwear. Cotton and non-abrasive fabrics are best. Next, minimize wearing extremely tight pantyhose and underwear, or even extremely tight skirts and pants. Next, do not spend too much time in extremely hot baths or hot tubs. And lastly, change out of swimwear and exercise wear or any type of wet clothing as soon as you can. If you believe you're suffering from yeast infection, it's best to consult a gynecologist as early as possible. During your appointment, you'll be asked several questions about your medical history. If you are currently taking antibiotics that could have caused your infection, it's best to have a sample of it with you during your appointment. A pelvic exam may be required. Your doctor would want to visually inspect affected areas and check for any existing external symptoms. The exam may also include the use of a speculum, which is necessary for holding vaginal walls open. A sample of your vaginal discharge may be required. If it is, it could also be put under a vaginal culture test. However, these tests are more often than not deemed necessary only when a woman suffers from recurring yeast infections. For uncomplicated yeast infection, which is characterized by mild to moderate symptoms as well as infrequent occurrences, a short course vaginal therapy will likely be prescribed. For the simplest cases of yeast infection, a one-time oral medication may already be sufficient. On the other hand, those suffering from complicated or recurring yeast infections will likely be prescribed oral treatment requiring multiple doses or a long-course vaginal therapy that may last up to 14 days. In the worst cases, a maintenance plan may be prescribed to keep symptoms in check at all times.